powerhouse champion of community pharmacy, because although she has a biochemist background, she has spent the most part of her career supporting community pharmacy in some way, shape, or form. She is a former director of procurement at Lloyd's Pharmacy. She was a strategic, and I'm going to read this out because I actually had to write it all down before I came on. But she was a strategic relationships director at BD, and most recently she has been the MD of Avicenna, which is one of the UK's largest independent pharmacy support groups. So, without further ado, I'm going to bring Bharti on.
Good evening, everyone. Good evening, Kamal. How are you?
Good, thanks, Bharti. I hope I didn't mess up your introduction there. I was like going through everything thinking, I'm sure I've missed something, because I know just how much you've done, and I'd written it all down and I was like, there's going to be something I'm going to miss here.
No, you did superbly well. I think there was just one role which I had, strategic relationships director in home care.
That's so right.
Again, another super pharmacy as well, and a great illustration of pharmacies at its best.
Thank you so much for joining me. And we've connected several times, and I know your story, but I want those colleagues who are listening to hear your story. So tell me about Bharti Patel.
Okay. So as you can probably guess, I smile a lot. I'm a very chirpy, positive person with a lot of drive and energy. I think, Kamal, you're the only one I've met who's got more energy than myself, actually. Biochemist by background, but interestingly, the shape that my career has taken, so many times people have said, oh, well, you're a pharmacist, aren't you? You're a pharmacist. And no, I'm not a pharmacist, but as you say, I've worked in pharmacy for a good part of my career. I've always been in healthcare, and this has really stemmed from the fact that, yes, I had a science-based degree, but like most Gujarati girls, you grow up in an extended family. I had my grandparents living with me when I was growing up as a child. After marriage, I had my in-laws who stayed with me, for the duration of their lives. And so pharmacy played a very critical role, and I saw it all the time, the interventions which we had. And, it was all about well-being and then condition management, and then, making sure that people were looked after through their lives to have the best quality of life they could. And really my career when early stages was in the NHS, doing NHS commissioning. And then I was very keen to move into private sector. And my first role really in private sector was as a buyer at Lloyd's Pharmacy. I was buying generics drugs, actually. And it was in a period when there were loads of off patents, parallel imports were plentiful, lots of things to do with pharma companies. So it's a very exciting time. I was probably about in my late 20s at the time, about 26, 27 years old. And I was like a bee to honey. I just loved it. It was so exciting. And it was a great business to be in. There was lots of things happening. And that's where the love of pharmacy really came, for me. And then from there, I moved forward, worked in home care. And again, it's like a super pharmacy with very specialist drugs, but you look at very advanced clinical skills of pharmacists there in terms of managing these patients on these very specialist treatments. And then when I went to BD, they have life sciences and medical, and really looking at the medicines management pathway with hospitals where there was a massive push towards automation and getting pharmacists to be ward-based, which was absolutely phenomenal because it meant they could manage TTOs and, the clinical management of medicines for patients so much better. And then really came into Avicenna, where I had the opportunity to work with the independent sector for the first time, and it was absolutely magic. So I have a lot of respect for independent community pharmacy, and was privileged to be there to support them through COVID-19. And, for my small part, all I can do is to, recognize their resilience and courage, which I will never forget.
I think so many of us see you as somebody in pharmacy who we all look up to, because, like you've said, your experience and seeing a woman, of color at director level is rare.
Mm.
You know, it's rare. And I remember when you did that piece, I think it was for Pharmacy magazine.
Yeah.
And I had several colleagues saying to me, have you read this article about Bharti Patel? Because, you know, this is what we need. You know, we need women, strong women like Bharti Patel, who are there, who are supporting the profession and showcasing the diversity within it.
Yeah. 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 I think you're absolutely right. And I think things are changing, but not at enough pace. I mean, if you look at pharmacy, there is a very high proportion nationally of female pharmacists, but you don't see enough of them progress to higher levels. And certainly within the corporate world, you don't see enough of them there. I don't think pharmacy is the only profession either. You know, I've seen it in other professions as well. I try to do the best I can, you know, to try and help any colleagues which I can that want to progress in their career. And I still remember this moment, you know, and I was talking about my time at Lloyd's, and I joined as a generics buyer. Within 8 years, I became a director. And to this day, I still remember walking out the building to go to the car park, and this girl came and tapped me on the shoulder. She said, "Are you Bharti Patel?" And I went, "Yes." She said, "You're the lady who's become a director, aren't you?" And I was like, yes, I am. And it kind of dawned on me then that it absolutely means something to be an ethnic woman and to become a director, because in my life, I'd never really thought of color, gender. I don't see differences in people. But it is, you know, when individuals feel that they need a bit of courage and support and guidance, that when they look at somebody who's been able to break the glass ceiling, as they call it, it encourages them. And in my career, I have had women come to me to ask if I'd be a mentor for them. And I guess my greatest joy had been with a lady who was very, very capable. She was very strong in the finance sector. And she had the makings of being a finance director. And everybody was saying, oh, you know, she could be the next FD. And she was like, Bharti, I can't be a director. How can I be a director? And I said to her, you know everything. You know, you are the most knowledgeable in the room. You just need to find your confidence in your voice. And we worked at it, and she did it. And credit to her, she showed the courage. And then when the role of FD came up, she got it. Yay. It was such a very proud moment. It was fantastic. And there are so many examples like that. And I do feel that wherever we can, and certainly wherever I can, if anybody reaches out to me for help, hopefully all the people who know me will know this. I never say no to anyone. My door is always open. And generally I can help because of the span of industry experience I've got. But if I can't, there is always somebody I know that will help them. And it's always in there. I think the way I describe it is, if you think of a sculptor, when they look at a rock, they can see the image and the beauty that sits within there. All they need to do is to chisel off the pieces on the side so that everybody can see the beauty that sits there. And for my part, if I can do something to help that individual on the journey, then I'm always there to support them. And I hope to continue doing that certainly in my life as well, both socially and professionally.
And, you know, to hear someone of your caliber say that is just, I think it means so much to other women pharmacists who are listening, and, you know, who perhaps have got leadership ambitions and they feel like they haven't got the confidence to do it. But to hear your story is really inspiring. And I know when I reached out to you, you know, you were MD at Avicenna, and, you know, and we had a great conversation, and what I felt was an instant connection was you didn't say no. You just said, yeah, great. Let's have a conversation. Let's meet up. And I think it's very rare to find that kind of level of humility, I think, in people. You know, when someone reaches out to you and they actually say, you know what, yeah, let's have a conversation. It's no skin off your nose, right? You know, sometimes it's that fear. If I reach out to that, you know, managing director, are they actually going to give me the time to speak to them?
Yeah. I mean, I think, you know, to be an MD, you're not at the top of the tree. The person at the top of the tree is the patient. Yeah. And then behind the patient is our pharmacy teams. And then there's a head office. And the MD is right at the bottom, because the role of the MD is to just make sure everything's in place to meet that patient need and the needs of our pharmacy colleagues. And so, when you say it's quite humbling for an MD to do that, for me, I see that as that's the responsibility that you have. That's why you're there, is to make sure that the organization can deliver at the front end. And I think if you look at COVID-19 and everything that happened, it happened at such pace. And an independent didn't have the full infrastructure that a corporate chain would have. They had to use their own clinical judgment. They had to use their leadership skills in order to know how to look after their patients, both in terms of their clinical need, their safety, the safety of their staff and their families. And they did it, and they showed immense courage. And I do think that when I look at a pharmacist, a pharmacy manager, they are a mini MD of their own business, really, because they're managing the dispensary, they're managing the purchasing, they're managing their systems and their IT, what they choose to put in the front of their shop in terms of retail merchandising, what services they do, how they upskill their teams. They are running a business. And I'd say, the ones who I've seen, in my experience across the independent sector, they are at different stages of their life cycle, their business life cycle. Some of them are just starting out and they really want a bit of support on how to get up and running. Others want to increase their number of pharmacies they've got, and so they're beginning to go up the tier of leadership a little bit more in terms of, if you're not on site, how do you manage that pharmacy? Others are looking to diversify, and a lot of them are looking at this in terms of different types of services. And certainly I've had a lot of pharmacists contact me around how they can shape their plans going forward around clinical services. And, when you look at how pharmacy is changing, it's phenomenal. But as a pharmacy leader, you have to be prepared to invest in yourself as well. Don't let yourself be the limiting factor in your own business. Take time to look after yourself, take care of yourself and your well-being, but also invest in yourself, that if you need training in certain skills that you wouldn't have normally received through your degree, then, take time to put that in, because it will pay dividends both for yourself and for your business.
Yeah, absolutely. And I know Sunil's commented saying Bharti's played an integral part in shaping and transforming my role, both commercially and innovatively. Great to see gorgeous finally having you share your story, and it's true. I know so many pharmacists that feel that you've helped shape, what they've done, in their careers. And, you definitely are that person that we kind of look to. And I think it's the fact that you're a really great relationship builder.
Mm-hmm.
And you really take the time to understand a person.
Mm.
And, we've talked previously about values and how values have got to be integral to everything that you do, right? And you saying that piece about, really investing in yourself. It's only then that you can really understand what your values are and and how that shapes the mission of what you're doing, right?
Yeah, you're spot on. And I think if I look at leadership, it all starts from listening. Yeah. And certainly in every role I've taken through my career, the first thing I do within the first 100 days is listen to the customer, listen to what their pain points are, what the challenges are they're facing, listen to what their aspirations are. And, life is a journey, but people often think the journey is just about getting to the end point. It's not just about, it's good to know where your end point is, but life is actually the journey to get to the end point. And that can have its setbacks, it can have its highs and lows. But what's important is that you surround yourself with positive people that you can trust and act with integrity, that will help you on that journey and make it an exciting journey for you, and often help you along the way. But what you find is when you're asking help of others, indirectly you're also helping them back. When I coach somebody as a mentor, I always learn something back myself as well. It's tremendously fulfilling, and I'm sure as a career coach you see the same, Cornwall. Yeah. And And I think it is about, being, just ask. I always say to my children, if you don't ask, you don't know. And when I've had independents contact me, and they'll say, Bharti, I just want to know about this, and I'll pick up the phone, I'll talk to them and ask them, and oh my gosh, didn't expect a phone call from you, but you're the customer, you know what's going on at the front end. You are the best business plan, really, because you know what's needed. And often, when we've had when I've had discussions and talked about things with my with pharmacy, they've said, well, actually, I never thought about my customer. What you're saying works as where you're where you're supporting us, but I could do the same for my customer as well and develop a similar kind of business plan. So it kind of continues. So the success is not in the independent. The success is of the independent to their customers. That's the end point. That's it. And relationships you touched on. It is really important, and a number of my roles at director level have been on strategic partnerships. Across primary and secondary care pharmacy, working with suppliers as well. And it's about listening first and understanding, what are the critical success factors and finding a common ground. And then, working with it together, because if there's mutual benefit in it, then everybody's a winner. And generally, when you're in healthcare, if business to business is a win-win, the patient will also win as well. And that's where the greatest satisfaction comes.
Yeah, definitely. There's so much of what you said that really, it is so critical to us developing in pharmacy. It's like understanding what our patients need and understanding that gap and filling that gap, right? Really spending the time to actually fill that gap. And, the more we do that, the more we listen, the more we pay attention to that, the more we find the ways in which we can actually best support them, right? And that ultimately leads to a successful business.
Yeah, absolutely. And I think if I look at pharmacy, one of the strengths, there are many strengths in pharmacy, but a very key strength is you know a lot about your patients. You know exactly what their illnesses are. You know what their chronic conditions are. You're in the community. You generally know the families as well. And you build this rapport. And I see this just in our village pharmacy here. We have a very good dedicated pharmacist, and he knows all of the community very well. And so within your business, if you know a lot about your customer base, that actually then to apply things like NHS and private services, the customer might not know what they need, but suddenly, when they come in, you say, you could do with having a blood pressure check. When did you last have it checked? It gives you a great opportunity to be able to do that and help their overall well-being. And I do see that this is really appreciated by patients, because particularly when there's restricted access at the moment to getting to see a GP, a number of the pharmacists I've worked with who are independent prescribers have been doing minor ailment schemes or prescribing certain medicines, providing emergency medicines, which has been phenomenal. And it's really great, because I think the consumer is now seeing pharmacy in a different light.
Yeah.
And certainly at government level, I think MPs are more aware now of the wider role that pharmacy can play. And, I was absolutely delighted to see NMS expanding in terms of the number of ranges of services it could do. Hypertension as well. These are all chronic areas where I think what I would love as an aspiration for pharmacy is that in the same way GPs have their own patient list, dentists have their own patient list, that pharmacy has its own patient list of chronic patients that you can really look after. Yeah. And I think that, to me, would be a big step forward for within the ICSs and certainly for patients.
Yeah, definitely. You've touched upon what I was going to ask you about, which is, how do you see it? How do you see pharmacy changing, right? Yeah. Where do you see us moving towards as a profession? And, as you've said, that patient list, but also it's our patient. And I take this from Sunil. Sunil talks about this when he talks about his patients. It's not my patient or the doctor's surgery's patient. It's our patient, right? Yeah. Patients access different healthcare professionals at different points in their healthcare journey. And so, we all have a critical role to play in supporting that patient when they need that help and and they need to move forward with their health. So yeah, anything else that you see in terms of pharmacy that you think this is the direction in which I see kind of community pharmacy going in?
Yeah, I guess I had the opportunity to work with secondary care pharmacy a lot as well, and it's getting tremendously busy there, and I know that with some of the very forward-thinking NHS trusts, they're very keen to work as part of the ICSs on an integrated medicines management pathway. And that way you've got better continuity of care of that patient being managed in primary care and secondary care. And so what I would really love to see going forward is that when pharmacy are in a position where they can manage primary care, chronic conditions, that there is a role that specialist pharmacists could actually work on in terms of integrated patient care when a patient is receiving care across primary and secondary care on a single patient record. I'm thinking about things like oncology. When you think about oncology, the patient prescriptions that they're on, FP10 within primary care, they may have side effects of what they're having in secondary care.
Yeah.
And those two things don't join up very effectively. Whereas, if you've actually got that as a single patient record, and that medicines optimization is happening across primary and secondary care, it means the overall patient experience is much, much better, and the outcomes will be a lot better. And I couldn't agree with you more. The language should change to our patient, and it's a multidisciplinary team that engages with pharmacy, primary and secondary care, and sometimes home care as well, because that's a third element where they also could be receiving home care drugs as well. And all of that needs to be joined up. And I think the capabilities there, I certainly think a number of pharmacists within secondary care would welcome working with primary care. We just need the regulations and the systems and the IT systems to allow it to happen safely with the right governance in place.
Yeah, absolutely. I'm going through my questions to see what I've missed out, because I know I've missed out so many questions that I wanted to ask.
Is that my fault?
I want to touch again upon this point of, being a woman and at leadership level, and often being the only woman at the table. Forget woman of color or whatever, it's just like the only woman at the table, right? How do you go into those types of situations with confidence? What do you do?
It's a really important point, actually. Plus, I'm only 4'11" as well, which doesn't help, So, it's tiny little.
As a 5'1" woman, I know as well.
You have to show courage. Yeah, you really have to show courage. I'll be honest with you, it can feel very intimidating. I've been in rooms where there's 18 colleagues in the room, and they can all be male, and you're the only female there, and it just feels very different. Yeah, different organizations approach it in different ways, and I think the industry is trying a lot more to get the gender, the ethnicity and disability balance around the table a lot more. And I know that a lot of organizations practically drive it because they see that when you have a greater female influence at the table, it does put a slightly different spin on some of your business thinking. It brings a lot more I think the term is called emotional intelligence to the table. It can be quite daunting, but you just have to show courage, and people think that I'm really assertive and very confident, and yes, I am, but that's developed through experience. You have to be courageous, and you have to be yourself. When you go into those rooms, we all have a responsibility, including women, because women can be biased towards women as well. We all have a responsibility not to have an unconscious bias. We should go in with an open mind, judge individuals based on the merit of their work, and treat everybody equally. And it doesn't always happen that way, but you just have to be resilient and kind of play your part and hope that your results and your performance and the way you build rapport with your colleagues will enable you to get there. And a lot of companies are putting in training programs to encourage more women to actually go for those higher positions. And often, as women, we don't have the courage or the confidence to do it, so we have to stand up and we have to be strong, and we have to have strength in order to try it, at least to make an application and go for it, or at least understand that where would we like to be in our careers, and in order to get there, what are the skills and experience that are needed? Because certainly in my career in healthcare, people will always help you. If you say to somebody, I'd love to get some experience doing commercial contracts, generally there are people who say, well, okay, then let's give you some experience. And certainly anybody who approached me, and they weren't all women, some were male, some were just very young people that needed the experience. If they came to me and said, look, I'd really like to get some experience doing X, Y, and Z, it's fantastic, because you've got another set of hands on a project. But more so, that diversity from where they've come from will give you a different viewpoint, different to your own viewpoint. Yeah. And that really brings a very rich tapestry of thinking then. But you have to be true to yourself, always act with integrity and honesty. And I think certainly for me, if you ask me one word that describes my values, it's authenticity. That's the most important to me.
Yeah, and you know what? Leslie's just said that as well, because she's just said, we're blessed to have Bharti in the industry. Such dedication and drive. The pandemic has shown the whole country how vital community pharmacy are. And Bharti's some amazing ideas to shape some critical changes going forward. I'm blessed to call her a friend.
Oh.
Bless you, Leslie. It's so true what you say about, having that courage and, and putting it out there. Right? Actually saying to people, this is what I want to do. And I don't think we necessarily value that enough. We don't kind of keep it within ourselves. Oh yeah, I want to do this thing, and I think there's a fear about kind of putting it out into the world.
Yeah.
And, and when we really kind of like reflect on it, well, there's what's the fear? What's behind that fear? And often when you kind of delve into why am I feeling this fear? Well, it's completely unconfounded, right? It's like, we talk about how, when you're starting something new, the more you talk about it, the more people are actually going to come and say, hey, that thing that you talked about, I know such and such person who I can put you in touch with. And I see that time and time again. I've seen it in the work that Sunil and I have done. I've seen it even with my career coaching work. The more you talk about what you're doing and the more you talk about the reasons as to why you're doing it, the more you find that actually those connections and those relationships and those people will come in your way, right?
Yeah, I think so. And when I talked about my early start in career, when I was at the Health Authority and I was a contracts manager there for primary and secondary care. And I remember the head of governance, and she said to me, and I was only about 26 at the time, and she said, you've got the makings of being an MD. And I was like, no way. I can't. Are you kidding? I could not take that level of responsibility. She goes, you're so passionate about your work, and I was thinking, I really don't think she knows me. And then when I was probably about 8 to 9 years later, and I had somebody that I asked him to be my mentor because I needed some support. I was still quite young in my career and I didn't really know what it meant to create a development plan, etc. And he was mentoring me and he said, you're head of purchasing, but you could be director of purchasing, and I was like, I can't be a director. Why not? I couldn't take on that responsibility. I can't do it. And in your mind, you just tell yourself, I can't do it. And he said, well, how different is it? Look at the responsibilities you're taking at the moment. If you've got, and it's about surrounding yourself with people that are going to support you to help you along the way, but also in a realistic way. If there's some things they said, if they said to me that, I wanted to be a rocket scientist, there was no on earth with my physics that I could ever be a rocket scientist. You have to be realistic with people.
Yeah.
But often it's about just not giving them, you're not giving them the solution, you're just asking the questions to get them to find it within themselves. Yeah. And that takes time for people to want to invest in you, but you have to ask first. And when you do ask, you'll actually find a lot of people will step up and say, well, actually, yeah, I'm happy to help you. And it takes time. It doesn't come overnight, and life isn't a straight line, as we know. It's got lots of bumps along the way. Some things won't happen, you might have setbacks, but then there are certain times when you'll accelerate.
Yeah.
And it's about reviewing it all the time. Have a plan, have goals, talk to people about the journey you want to take. And it might be a very holistic plan, which is think about friends, family, your career, and yourself. Always put yourself in there as well. And I think often in pharmacy, they forget about self.
Yeah.
They'll think about their business, they'll think about their team, think about the family, they'll forget about themselves. So you have to put yourself there, because if you don't look after self, how are you going to keep things going? And if you look after self, you will radiate a lot of positive energy as well around these people. And when you radiate energy, you get everybody on board, and there's a great level of excitement and hope. You have to be able to give hope.
Yeah, giving hope. We often forget that, don't we?
Mm.
That actually, in our roles, we are giving people hope, aren't we? And it's such an important part of what we do.
Yes.
I don't know who this LinkedIn user is because I can't see their name, but they've said, having worked with Bharti for a number of years, authenticity and courage are perfect words to describe Bharti.
Oh,
So nice.
I'm getting emotional now. I've worked with some amazing people. For Diwali, I put a message on LinkedIn. I said, about all the amazing people I've met, and so many people responded. And I was going down the list and literally just think, oh, these people are just treasures. They're just gems. It's just, I feel very privileged.
Yeah. Yeah. And, that comes back to, what you were saying earlier about how it always comes back to the end person, the patient, right?
Mm.
And having that person in mind and working towards supporting that end patient and their well-being.
Yeah.
And being clear on your values and setting your goals. And it was Mark R, he says. And Yusuf's just said, well said, Bradley, self-care is so important, right? Going back to this point of self-care, in pharmacy, we put absolutely everyone else first. Every single person is put first apart from ourselves. And taking that time to really care for ourselves is going to only radiate right towards the people that we're serving, and our businesses, and our the staff that work within our businesses. So before we wrap up, I want to ask you, what do you think? I mean, to a community pharmacist who's listening to this today, what are their barriers, do you think, in terms of them moving forwards with their business? What have you seen as their barriers?
Yeah.
And how do they overcome them?
Yeah. So a friend of mine gave me this great analogy that if you think of a snow globe, as a child when you play with a snow globe, when you shake up the snow globe, there is a lot of snow and you can't see the image there.
Yeah.
But if you just let it settle and slow down and pause, you can see the image a lot clearer. And I think what I'd say for pharmacy is you have to take time out to stop and pause and really think about what you want and what do you want for your business. I think about what you want to achieve in what time scale, and then break it down into its component parts and understand how are you going to get there, and be realistic, because if you don't take time to pause, you're constantly on this kind of hamster wheel.
Yeah.
And you either don't notice the changes that are going on outside, in the sector, or you know they're happening, but you kind of hoping it's going to go away, and of course it's not going to go away. But if you actually calm down and actually stop and take time out, with a blank sheet of paper, write down where you are now and where you want to be, and then you can say, okay, what do I need to do in terms of the systems? What do I need to do in terms of my people? What do I have to do in terms of myself? And then break that down, and then from there develop a phased plan, then that will really stand you in good stead. And then just review it every 6 months.
Yeah.
So to me, I think it's slow down to go fast.
Yeah.
Take that time out because it's valuable time.
Such great advice, to slow down to go fast. You know, and Sunil said, love it. Snowpause clarity. That's a new hashtag, snowpause clarity. You know, and absolutely right. You know, I think, you know, not enough pharmacists take that time out, right? But you've got to, it's like, it's mission critical for your business. You've got to say, no, I'm blocking out this time.
Yes.
I'm taking myself away from the business, and I'm really going to think about how I want this business to go and what I want out of it. You know, what are my values? What do I want to achieve? You know, what do I want my, and this is, you know, I'm getting into coaching now because you all know this, but you know, it's that whole, you know, it's putting that vision in place and working from that vision, right?
Yeah, and I guess, you know, I was just going to say before you said it there, Komal, you know, you do career coaching and business planning. There's help there, you know, and there is a way of doing it to simplify the process, and it's difficult to do on your own. But, you know, that's the kind of support which you're able to offer. So there is always somebody that can help you, but it's time well invested.
Yeah. Yeah, absolutely. Thank you so much, Bharti, for your time. I really appreciate it. And, you know, so much gold in everything that you said, you know, authenticity and courage, and, you know, the snow globe analogy. We're gonna create a hashtag around that. It's going to be viral. the hashtag snow pause. But I'm so grateful for you and your time, and so grateful to know you as a person, and, you know, have had our paths cross. And I hope that anyone listening to this reaches out to you, because, you know, you are such a huge champion of community pharmacy and pharmacy in general. And, you know, I just cannot wait to see everything that you go on to achieve.
No, thank you, Komal. You know, and thank you to everybody who's taken time this evening to join us. Thank you to all of you, and I'm really humbled by it. So, if I can help anybody, don't hesitate to reach out to me through LinkedIn. I hope this has helped in some way, and thank you for inviting me on your show. And happy to support anybody in their development. Thank you.
Thanks, Bharti. I will see you soon.
Thank you. Thanks very much. Bye.
That was Bharti. Amazing discussion that we had. I hope you enjoyed it. Thank you so much to every single one of you who's listened in today, and for all of your amazing comments, and, you know, all of your questions that have come through as well. Really appreciate it. And if you need help with your career, and you need help with supporting your development in your career, then reach out to me. I'm here to support you in whatever way that I can as well. And I look forward to seeing you at the next Happy Healthcare Professionals live show. Take care. Bye.